Hi there, my name is Dr. Kara Amstutz. I am a veterinarian and the Director of Clinical Education for Canine Rehabilitation Institute. And I'm so glad that you are interested in considering having your dog join us as a dog professor. So I wanted to just give you a quick overview of who CRI is and what we do, and maybe answer some of your questions about whether your dog would be a good fit. So let's get started. So first off, Canine Rehabilitation Institute is a program that's been around for quite some time. We were founded in 2002. Two veterinarians came together to create our program. What they saw was a need for education for veterinarians and physical therapists to come together and improve our treatment of patients who are either injured or post-surgical situations, or maybe they've got neurological condition, or they're a geriatric patient that needs extra care. So they brought this knowledge together and created a certification program so that veterinarians and their technicians and physical therapists could gain these skills and offer additional therapies for their patients in practice. So our program, our teachers come from a wide variety of backgrounds, and I'll talk to you a little bit more about them in a moment, but our students are veterinarians, licensed veterinarians. We also have licensed veterinary technicians and assistants. We have veterinary students who are trying to get a leg up on once they graduate, they can earn their certification. We have physical therapists, licensed physical therapists. We have physical therapist assistants. We have PT students. And we now also allow occupational therapists and occupational assistants into our program. So it's growing over the years. The demand for rehabilitation has grown in the United States, but also all over the world. We started off as a certification program teaching veterinarians and PTs how to do rehab. Rehab, we call it rehab because I'm not a physical therapist, so I cannot say that I do physical therapy in pets, but we call it rehabilitation as a kind of a catch-all terminology. We have rehab certification, we have acupuncture certification, and we are just also rolling out a certification in custom orthotics and prosthetics for patients who need extra bracing or assistance. So that's really exciting. That's going to be coming out this fall. And then one other thing that we have in our program is a wide variety of continuing education. What we have found is when people get certified, they get that certification, they love it, they take that back to their practice, they are able to help their patients in ways that they never knew was possible. And now they want to know more. So we have created quite a few CE courses on things like osteoarthritis, sports medicine, exercise physiology, myofascial therapies, and more. And kind of the way that our programs work is many of our classes are what we call hybrid, meaning the students need to watch some videos ahead of time that kind of lays out some of the foundational knowledge. And then when they come to class, we do a combination of lectures and quite a bit of hands-on learning with dogs. And that's something that makes our program so special. So, what makes CRI the best? Well, we kind of feel like we are the best. And the reason why we say that is because we have a very long legacy of very high quality education. And that comes from a variety of places. So, first of all, our instructors. We have a fairly large teaching team that has a variety of experiences and backgrounds. A lot of our instructors, uh, well, they're all certified in rehab, but many of them have additional certifications in things like pain management, acupuncture, chiropractic, things like that. But then we have several board certified in specialists in sports medicine and rehabilitation. And then we have many PTs who are canine rehab certified as well. So our teaching team is vast and varied. And the other really nice thing about our instructors is we're all in clinical practice. Most of us own a rehabilitation practice. So we are seeing patients, during the week, and then we come together and we share this knowledge and our experience with our students as a very inclusive and encompassing educational program. The other really big thing that makes CRI so great is the amount of time that our students have with their hands on a dog, and not just any dog, a live dog. Some of the other programs have um, cadaver dogs or model dogs, which offer a great learning opportunity, but it's not real world. In practice, the students are going to be handling dogs that are kind of wiggly sometimes and maybe don't want to hold still for this special test. So it's good for them to learn using live dogs, a wide variety of live dogs. So many folks who are interested in looking at allowing their dog to be a dog professor kind of want to know, like, what's the schedule like? What am I looking at here for my commitment? And basically, the class schedule, we hold classes, 2 to 3 classes per month. They typically span over the weekend, like a Friday through Monday, Friday through Tuesday. Our classes they vary from 2 to 5 days in length. And within each day, there could be 2 to 4 hands-on labs each day. Our lab groups are small. We have one instructor to up to 5 students. Sometimes it's even less. Sometimes we do offer like a large group demo, meaning we've got the instructor at the front of the class with the whole class kind of watching a demonstration of an assessment or a treatment. But most of the time, the dogs are in enclosed rooms, away from other dogs. And when they're in lab, it's kind of quiet. And we try to do, very fear-free types of techniques. We're very slow and calming with the dogs. We want this to be a good experience for the dogs as well. And so we really model how our students should handle these dogs, and we're very careful with making sure that the dogs stay comfortable. So what happens during labs? Well, it kind of depends on the class and what we're doing at that particular lab. There's a lot of palpation, and palpation just means hands on the dog, reviewing anatomy, reviewing how to palpate specific joints, how to do what we call special tests, which would be things like looking for an instability, assessing range of motion. So that's where we, have them bring a limb all the way up into flexion and then all the way down into extension. And we actually teach them how to measure that. So we use tools around the dogs that are, just easy to use tools. The dogs don't ever seem to care that we're measuring things, but we do use things like to measure muscle girth, like around their thigh or around their forelimb. We'll do neurological special tests. We do orthopedic special tests looking for specific conditions. And what we're really doing is we're trying to train the students how to appropriately do these tests. So, the dog may have a specific hip test done several times, once as a demo, and then 5 students doing that specific hip test. And then we'll do additional tests further down the limb. We also do things like posture assessment, strength assessment, and gait assessments. And then we teach the students how to apply certain modalities like NMES, which is neuromuscular electrical stimulation, where we put little pads on the muscles and get the muscles to either fasciculate or contract. We also have, depending on the class, we may teach the students how to apply kinesiotaping, which is the picture in the top here. We can have them practice doing things like cupping or using tools to treat the fascia. And then if you happen to sign up for an acupuncture course, we actually do acupuncture treatments on the dogs. And then finally, this picture at the bottom is showing a lab where we are teaching the students how to get the dogs to do different therapeutic exercises. So it really varies on what happens in the labs. And what I'll tell you is if you decide to allow your dog to be a professor, then we will have the schedule available that you can look at, what dates and times you might be available. But also we always write down kind of for each lab, what we need for the dogs. Dogs that can do the therapeutic exercise where we're having them be active is a different dog than what we would want necessarily for things like assessment of range of motion, because those dogs, what we really need is for them to lay down and be okay laying on their side for a while so that we can practice doing the techniques and measuring. So some dogs can do both, but a lot of dogs are like, I can do exercise, I can do like I'm up and about doing things, and other dogs are more calm and relaxed, and those may be the dogs that we would want you to sign up for the hands-on. So, what makes a good dog professor? We like a variety of shapes and sizes, different activity levels and conditions. Uh, at at our previous location, we had several dogs who were athletes. Maybe they competed in agility or scent work or barn hunts or fast cat. We also have several dogs who are former competitors and they are, wanting to stay active and continue to do things that are enriching for the dogs. And the dogs really love it. They love all the attention that they get, um, especially if they're previous competitors. They like to do things, and so we enjoy having them. Other things that makes a good dog professor is a calm personality. The dogs are not necessarily right around other dogs. We try to keep them separated, but they're in an environment that if we've got one dog that's really ramped up, it can kind of get everybody a little nervous. And it's a better learning environment for the students if the dogs can stay pretty calm. Obviously, they need to be people friendly. We need dogs that don't mind to be touched, that don't mind to be in a room with strangers that they don't know near them, looking at them, watching them closely because a lot of times we're watching how they're moving. So that's pretty important. If the dog is fearful of people, then this probably isn't a good place for your dog. Now, if they're dog fearful or dog aggressive, we can work around that as long as you let us know ahead of time. Again, we don't really ever have the dogs come in contact with other dogs. They're housed separately and we walk them away from each other. We really don't want any interactions just because you just never know. But if they're dog aggressive or fearful of other dogs, we just need to know that so we can make special arrangements. This next thing on the list is that they'll lay down on their side for a period of time. So this picture is actually my dog, and I'm demonstrating, how to just kind of getting ready to do some passive range of motion. And, what we like to do is give the dog a soft little bed to lie on. But they do really need to lay down and lay fairly still for us if they can, so that we can really do the correct assessments. One of the things that we really focus on is correct hand placement and utilizing the tools well. And if the dog is really wiggly, it's hard to really fine tune how our students are doing the steps. And it just makes it so much easier to teach and for the students to focus on the learning rather than constantly trying to get the dog to settle. Also, dogs who like treats are good. If they'll work for treats or positive reinforcement, even if it's not treats, if it's a toy or something that they love, we're happy to use those. But that's always helpful if the dogs, can be, you know, encouraged to do things for treats or positive reinforcements. As I mentioned earlier, on the sign-up sheet, if you decide to find out more, we can send you the sign-up sheet and it will have specific requirements that we would need for each lab. And one thing I will say is, if we have 2 or 4 labs in one day, what many folks do is bring the dog in the morning and just let them stay with us for the day, and they can participate in several different types of labs. Or if you can only do 1 lab or 2 labs that day, that's fine too. We would just want you to sign up for what you could sign up for. When it comes to their health status, they really need to be in good physical and mental health. I bring up the mental health because we recently had a dog professor retire. She was 16 years old. She was a very good little girl, but she started to develop some cognitive dysfunction and was just a little confused and I think was a little stressed out. So she retired. So if you've got a really geriatric dog that may be having some cognition issues, I don't know that that would be the best fit for that dog as well. They must be current on rabies vaccine, where we've got people handling your dog. So they've got to be up to date on rabies vaccine. That is a non-negotiable. When it comes to the other vaccines, what I would say is the dogs will be housed in an area where there will be other dogs. So, as a veterinarian, I would say make sure the dog is up to date on its Bordetella, which is for kennel cough, as well as distemper and parvo. Um, Most dogs are already up to date on those, but although it's not required, I would recommend that they be up to date on those vaccines, especially things that are like airborne diseases that they could get from just being in the same vicinity as other dogs. They must be free of parasites, so they can't have fleas and ticks on them. Also, intestinal parasites and heartworms. They should, ideally they're on some sort of a monthly preventative so that we're not worried about them bringing parasites to the other dogs, or even, ticks that could get off the dog and get on one of the students. We don't want that. Also, and this has happened a couple of times, folks sign up their dogs and then they come into heat. We really don't want to work on dogs in heat, mainly because it's very distracting to any of the male dog professors that are in the building. So if you sign up and your dog comes into heat, please just give us a call and we'll find a different spot for your dog at a different time. And also, we really don't want to work on pregnant dogs just because of the potential liability that entails. And also, your dog that's pregnant she's dealing with enough. She doesn't need extra hands on her at that time. So some other commonly asked questions that we've gotten is, can I stay with my dog while they're in lab? Really, we don't typically have the owners around because the dogs honestly do better without mom and dad there. Typically, what we do is the pet owners will drop them off in the morning and pick up later in the day. If they can stay all day, that's really helpful. When they're not in lab, what we have is a separate space for our dogs, and they each have their own enclosure. And we have a dedicated walking area, so they get walked, they have water. If your dog has a food allergy or they require a specific treat, we ask that you bring that treat with you to lab so that we can make sure that they get their treats, but we're not causing any upset tummies. Otherwise, we typically use Jiminy's treats, which are the protein source is crickets, and the dogs really love those treats. So we haven't really had any issues with those. Most dogs are not allergic to cricket protein source, but we always like to tell folks to bring something your dog will eat and that won't upset their tummy. One question that we get is, what happens if I sign up and I can't make it? Well, we would love to have at least 48 hours of notice, just because we have students coming honestly from all over the world for this education, and we want to ensure that they're getting the best experience possible. So having dogs there is so, so important. So if for some reason you sign up and you can't make it, then we'll need to find a replacement patient or dog to come in. A lot of times, some of our current dog professors, owners, if they couldn't make it, they'd call and say, "Hey, we don't have somebody. I can't come in, but my friend can bring her dog." And so that's great. If you have somebody to recommend, we would love that. Also, let's say you wake up the morning of and your dog just isn't feeling well. Maybe they vomited overnight or they've got diarrhea. Don't bring a sick dog. We'll figure it out. We'll try to find a replacement. Let us know as soon as possible, but don't bring your dog if they're not feeling well. We don't want to add stress to an already bad day for your dog. So I think that's the lowdown. I hope this has been educational for you, and I hope that you're excited about considering this. One thing I will say is that, why choose this? What's the benefit of this? In addition to, your dog's getting to go do something fun. Well, your dog is teaching the future. This is really, rehabilitation is a fairly new area in veterinary medicine and the physical therapy world. And it's grown dramatically over the last 20 years, but we're still trying to get the word out there what rehab is. And many of you may compete in athletics, agility, things like that. And that there's a limited number of professionals out there that know how to assess your pets appropriately, know really what your pets are putting their bodies through. And so having dog professors in abundance is so helpful for our students, but also future pets everywhere. So we would love it if your dog could be a part of that future. And also, it's really fun for the dogs. It's like socially rewarding for the dogs. They get lots of enrichment. And every day that you bring your dog for a lab or a day of labs, you get a $25 Amazon gift card. And the joke that I always tell folks is, the dog gets to decide how you're going to spend it, but you do get $25 for bringing your dog in. So I hope that answers your questions. There is on our Canine Rehab Institute website, we do have a dog professor page where you can see some pictures and learn some more information. And then also, if you're interested, please email us at info@caninerehabinstitute.com and give us your name, and we can send you additional documentation and kind of get the ball rolling for you. Our first class is coming soon, so we would love to have you sign up. Thank you so much.